President Barack Obama has targeted healthcare reform as one of his national priorities. So we spoke with Dr. Max Michael, Dean of the UAB School of Public Health, and asked what he thinks President Obama should focus on when it comes to enacting public health policy. Dr. Michael thinks the president should take a long-range view.
I think there's no question President Obama has a real difficult job in front of him, dealing with the economy, with two wars, with a broken healthcare system, with a public health system that is also struggling from lack of funding across the nation. I think the real challenge is to get the president and the administration to focus on solutions that are not hackneyed, solutions that are long range, that look beyond the usual interest groups. So instead of listening to doctors and hospitals or the AMA or whomever about universal access to care so that you can correct the problems for the uninsured, or we need to put more money into local health departments so that they can do immunizations better, I think we need to step back a little bit more and think about those things and those programs that would actually benefit the health and well-being of the country. If you ask people what makes you healthy, I think we tend to think about ourselves. So we'll say good cholesterol, nice diet, exercise. But if you kind of give people an opportunity to expand those thoughts and think about what are the things that make us healthy as a people, I think safe neighborhoods and good jobs and job security and a strong educational system resonate very well. That people understand that if you don't graduate from high school, if you're having to work 3 jobs just to be able to barely scrape by, that's not healthy. But it tends not to be the perspective that we take on a national level. The perspective nationally tends to be around institutions. So it is around the institution of health care, it's around the institution of public health, it's around the institution of the U.S. highway system. We tend to do that. We're kind of siloed people. So it's easy to think about roads and bridges and highways because we can see them and touch them and smell them and we use them, and so we know they're potholes and that makes sense, and we know that Fred down the street doesn't have a job and he'll get to work doing that stuff. Part of the challenge is the administration willing to shift paradigms in this tough time and think about social infrastructure as a critical component of the health of the nation? I think that part of the challenge for the new administration, the new president, is having a view of the public's health as well as public health that is sufficiently broad that it avoids institutional biases. Because it's going to be the institutions that come to the table with solutions. So it will be the American Hospital Association, it will be the American Medical Association, appropriately so from their perspective vis-a-vis healthcare. And it will be the American Public Health Association and the Association of Schools of Public Health with regard to some public health things, because that's what their job is. I think that the challenge is to synthesize those views, which are certainly legitimate and important, but there may be messages, views that transcend the institutions that ultimately would improve the public's health.